So today we're going to be talking about the dangers of spinal fusion surgery. I'm Dr. Brad Wolf. I'm going to be your host. And we're going to be talking about this. This is specifically interesting to me because we've been able to keep over 1,000 people out of spinal surgery over the last 10 years. And listen, not everybody, there are some people that I don't want to say they need spinal surgery, but it's a solution that's needed due to the severity of the problem. So I'm not in any way saying that nobody should have spinal fusion surgery, but you should know that if you're going to have spinal fusion surgery, there are consequences. The first thing is that you have 24 movable bones in the spine. And I show you the charts on the wall, but there's 24 bones in here, and your bones are designed to move and bend. Okay? You would not be able to move and bend your body if it were not for your spine and the discs between your spine. So we see these spaces between the bones, and those are called discs. And the discs are what allows you to move and bend. And so in the course of your life, because of some of the other things that we've spoken about in the videos around wear and tear and the breakdown in the human body, there is a degenerative process that happens in all people. And so we all start at this end here. And we begin to live our lives, and things happen, and we have slip and falls, and we have auto accidents, and we're sitting in front of the computer, and there's a wear and tear on the spine. So we have 24 movable bones in the spine, but if you injure them, if you damage your spine, then you're going to wear them down. And if you look at this particular segment here, look how ugly that looks. Okay? Happens very gradually over time. However, I've seen some people in their 20s and 30s that have more advanced problems than they really realized. Maybe not to this degree here, but they're getting a lot of compression on their spine through their posture, through their ergonomics, their relationship with their computer screen, how they're driving in the car. When they're running, maybe they're not in the right shoes, and there's all sorts of factors that can influence this. So, as we've spoken about, we want to get the body and the architecture into a better place. There is an ideal position for the body. I know that you may not have ever heard that before, or maybe you have heard that before. I know that, certainly some chiropractors and other people talk about the architecture of the spine. But we want to get that body into a more upright position in relationship to gravity. The compressive force of gravity on the physical and the bones and the joints in our body cause this deterioration. So somebody who is going to potentially have spinal fusion surgery, they've done so much damage to their disc, and the disc is between the bones, so much damage to the disc that they literally have to take the disc out and they have to fuse the bones together. It's without saying that, wouldn't it be better to keep your original parts? You say, of course. Well, we want to keep the original parts, but you have to understand how to keep your original parts working well. I see people who have been told they need surgery, that have had surgery that went bad, that are still in chronic pain as a result of both before surgery and after surgery. And with spinal fusion surgery, the biggest risk is that you basically you limit your options in terms of treatment. Because once you fuse that spine, once you put hardware, you put some metal in your back, they sometimes do what's called a bony fusion. They take bone from the hip or some other area and they pack it in there and they do a bony fusion. But even with that, you're going to limit your treatment options over time. The original is always better than putting something artificial in there. But if you do have to do it, there are some things that you need to know as well. And the things that I'm teaching you about to keep you out of spinal surgery are the same things that you need to do if you do have spinal surgery. I have a woman that came to see me recently, and she had fusion of her neck. She had I think 4 segments of her spine that were completely fused together. Took an x-ray and there's a big old plate and rod and screws going into the spine. Changes your life. You have to be willing to manage your surgery and the impact from that surgery for your whole life. I know people that have had fusion surgery at 25 years old. At 25 years old, you're taking care of your body for your entire life. If you live to be 100 years old, for 75 years, you have to have that metal in your neck, or you have to have that alteration in your body. So we want to think about how to preserve the joints in the spine. And if you look at your own life, you can tell, you know what you're doing. You're bending over all stressful. You're working on the garden, you're picking up your kids, you're doing work around the house. So many things. But this is really super important. And if you want to try to prevent surgery down the road, you have to think about it now. By the time you're already in the position that they're telling you that you need spinal surgery, the fix is a lot more involved. So I'm trying to give you a little bit of a heads up here to think about how you're using your body, what you're doing that's causing wear and tear, what are you doing with your architecture that you're all slumped over, maybe you like to sit on the couch, maybe you like to drive in your car, I mean there's a gazillion different positions that are going to be problematic. So there are answers to these issues, and if you're having neurological symptoms, you're having degenerative disc disease in your spine, which is what it is that we're looking at here. If you're having pain, numbness, tingling, weakness, and some other form of discomfort and suffering in your body, it's important to begin to start to reestablish as much normal mechanics of the body as you can. So I shoot this video to talk about the dangers of spinal surgery because I believe that spinal fusion surgery specifically should be a last resort. And I hope that most surgeons would also agree with that. We don't want to go into something that's going to alter the physical structure of the body without doing everything we can to avoid that problem in the first place. Keep your original parts in good shape. Take some action. Start an exercise program. Get some assistance from somebody, from your chiropractor, from your fitness trainer, go on YouTube, look at videos, begin to learn about your body. But what this channel is going to be about is helping you to distinguish fact from fiction. And what are the things that you need to do now to live healthy and to age the best way possible? The next video that we're going to do is going to be on fibromyalgia and what you can do about it.